Knock, knock. Hi, my name is Emily. I'm going to be your nurse today. Can you tell me your name and date of birth? All right. So I'm going to go ahead and do a quick set of vitals on you, do a head to toe assessment, and then we're going to give you, go over why you're here, what we're going to do for you, and how we're going to get you out of here, okay? All right. So I'm going to go ahead and do your vitals. Your vitals are going to be 99.8, respirations are 14, pulse is 88, blood pressure 146 over 80, and 95% on room air. I'm going to go ahead and have him turn his head, and I'm feeling for JVD, which is jugular vein distension. He doesn't have any of that currently. I'm going to go ahead and feel his arms. Are you having any pain in your upper extremities? No? He does have some pitting edema +2. I'm going to have him push and pull on my hands up and down. I'm going to check for cap refill. Okay, and it's less than 3 seconds. I'm going to go ahead and listen to his lung sounds. I'm going to do 8 on the front and 10 on the back. Go ahead and sit up for me. Okay. All right, so there are some crackles and diminished lung sounds on the front and back. And while listening to that, I heard his heart sounds, which were normal, S1 and S2. I'm going to go ahead and look at his stomach. It is distended, it is hard, it is present with ascites. I'm going to go ahead and double check and make sure that he does have some bowel sounds. I want to make sure that I go ahead and measure the ascites and mark where I measured so that when the next nurse comes in, she's able to measure the same and check whether or not it has gone down. I'm going to go ahead and palpate slightly because it is hard from the ascites, making sure there's no lumps. And he did have bowel sounds ×4. Are you having any gas? And when was your last bowel movement? I'm going to also ask if he's having, are you having any pain when urinating, any burning or stinging? No? Okay. So I'm going to go ahead and double check on his legs, checking for any edema. He does have pitting edema in his ankles as well. His skin is a little pale. It's warm and it's dry to the touch. I'm going to check for his cap refill on his toes, which is also 3. Have him push down and pull up on my hands to check for the push and pull. So he is able to do that. Are you having any pain in your lower extremities? No? Okay. So I'm going to go ahead and look over your doctor's order since everything is looking to over okay. So you do have some hypertension with that, so that means kind of you have some high blood pressure with the edema in your arms and your legs. We're going to go ahead and restrict some of your diet. Your mom had asked kind of what we were going to do about the diet. And what we do with nephrotic syndrome is basically what you have is we want to have a low and fat and sodium diet. We want to make sure that we're restricting as much sodium as we can because you are holding on to fluid. That would explain why your arms and your legs are swollen. We also want to make sure that we have a balance of your proteins. We don't want to have too much and we don't want to have too little because we are restricting your fat and the sodium. We're going to make sure that we keep a weight chair in your room so that we can get you every morning that you're here. We can go ahead and weigh you and see if us restricting the fat and the sodium is helping. We're also going to go ahead and give you some labetalol because that is going to help us bring down that blood pressure and we don't want it to be up that to 146, okay? So I'll go ahead and give that to you in a little bit, but we're going to go ahead and finish talk about what kind of things that we could do for you. So we're going to make sure that we're giving you some frequent hygiene in your mouth. because when we restrict these fluids, it's going to cause your mouth to become dry and your mucous membranes are going to be dry. We want to monitor your serum albumin and do urinalysis on you because your albumin will be increased and your protein in the urine will become less when we finally get you hydrated and stop holding on to all that fluid. We're going to make sure that we're monitoring your weight every day. And the way that we do that is we just weigh you every morning at the same time, checking to see if your fluid is being pulled off, or if we're adding any fluid, or if we're maintaining, and that'll give us an idea of what we need to do next. We're going to monitor your I&O, which is your intake and output. By doing that is everything that you take in, we write down, and every time that you urinate, we will take that out as well, and we'll see kind of how much fluid you're holding on to. And we want to monitor your respiratory status because if you become too overloaded, you will have crackles and wheezing in your lungs, and you can also become short of breath. And you did have some of those wheezes and crackles when I was listening to your lungs during that assessment, so that's just something that we really want to watch out for. So I'm going to go ahead and check all of my orders and things like that. I'm going to go grab some of the supplies that I need for this medication that we're going to give you, and I'll be right back, okay? Knock, knock. I'm Emily. I'm back. I'm going to just go ahead and give you some of your medication. Can you tell me your name and date of birth? And does he have any allergies? Okay. So I'm going to go ahead and make sure that I double check in the MAR again that I'm going to be giving labetalol 5 milligrams per 1 milliliter. And that is checking out. So I'm going to go ahead and grab my supplies, everything that I need. So I'm going to need some gloves. I need a saline flush, a syringe, an alcohol prep pad, my labetalol, and I'm going to have my primary tubing hooked up already, and I'm going to choose the port closest to the patient. So the first thing I'm going to do is go ahead and put on my gloves. So what we're going to give you is labetalol. Labetalol is for high blood pressure. We're going to administer over 2 whole minutes. And some side effects that you can have from this is tiredness, dizziness, weakness. He could get an upset stomach, or he could become lightheaded when he tries to stand up. So we just ask that if he does want to stand up, that we are with him the whole time. And then we also stand up slowly, sit on the side of the bed for a few minutes, just to kind of help with that lightheadedness when changing positions. So the first thing I'm going to do is take my alcohol prep pad, and I'm going to clean the port closest to the patient. I'm going to take my saline flush. I'm going to attach. Okay, and what I want to do is just making sure that it is, I'm going to flush it and make sure that it's patent. Okay, and then I'm going to throw away my saline flush. I'm going to go ahead and draw up my medication. I'm going to grab another alcohol prep and clean the top. I'm going to be administering 1.8 milliliters. So I'm just going to draw back to 1.5. I'm going to instill the air into the vial and draw back 1.8. Okay, and then I just want to double check again that this is 1.8. Okay, make sure there's no bubbles. I'm going to go ahead and take my other alcohol prep pad. I'm going to clean the site again, the hub closest. Okay, and I can either have the needle on it or I don't need the needle. It just all depends. I'm not going to need the needle, so I'm going to take the needle off. I capped it, and I'm going to attach. And it's still over 2 minutes. I'm going to go ahead and watch my watch. We're going to go over 2 minutes. I'm going to double check and keep watching the site of the arm, making sure that it's not infiltrated. That's another reason why I checked the patency. I'm going to watch for any discrepancies in the patient. If he's not tolerating it well, I will stop. If he starts having any reactions, I'm going to go ahead and stop as well. We're almost done. We got another minute. Alright, so that's 2 minutes. I'm going to go ahead and clean my hub one last time. Make sure to flush again to make sure that all the solution is completely in and not hanging out in the tube. Okay. And then I would be done. I would document the date, time, what I administered, that I administered over 2 minutes, how the patient tolerated it, the education that I provided, such as the side effects, what it was for, and any questions that the patient had over the medication or the family. And then I would check back in about 30 minutes to make sure everything was okay. So, what other medications the doctor could be administering to you would be some corticosteroids, some antibiotics, ACE inhibitors, and we're going to give some aggressive immunosuppressive therapy. So then when that is done, we can see a decrease in this syndrome as well. So making sure that, again, that we're monitoring weight is our biggest thing, and seeing whether or not we're pulling off any of this fluid and if this is getting better. We also really want you to focus on that diet, because if you aren't doing the diet, it's just going to continue to hold on to that fluid, and these medications aren't always going to work. Okay, so if you guys have any other questions, I'll answer those. But as of now, you guys are good to go. Hang out for a little while, and I will be back to check on you guys, okay? All right.